Guys, welcome back to Medical Coding with Blue. Today's episode is all about jobs to avoid as a brand new coder. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so over the weekend I was given a shout out on LinkedIn for two people who just passed their certification exam and thanked me and my channel for helping them with that. So it was two people, so I was like, wow, that is really awesome. So I really appreciate that. But with that said and with that in mind, you know, what kind of job do you get as a brand new medical coder if you can't find a job as a medical coder right away? So here are some jobs to avoid. We need to know what we need to avoid first, right? Before we're like really out there. I mean, because obviously, hopefully, you just got your certification, or even if you haven't gotten certified yet and you're out there applying for these coding jobs, if you need to get a job in the meantime, in between time, here is what you should avoid. And this is the number one job I'm going to talk about because I get asked this question monthly. And every single time I say the same thing. I have responded to it so many times. No, just say no to medical scribe. A lot of people ask me that. Blue, should I apply for a medical scribe to get my foot in the door as a medical coder? No. Why? Because they have nothing to do with each other. That will not help you to get a job in coding. As far as like being in a job that will apply your skills as a coder. You are a scribe. If you are doing scribe, you are listening to the appointment and what's going on with the doctor and you're writing stuff down. That's a scribe. That has nothing to do with coding. Now, obviously, you would know like everything that's in on that note, great. But again, it's not going to use your skills. And these jobs that I'm talking about today, they are not using your skills to gain experience, right? A lot of people talk about those foot in the door positions. I've done those foot in the door position videos about the other alternative jobs to get into that will use your medical coding skill and help build that confidence so that you can move on to coding. These again are the ones that you want to avoid. So medical scribe, please stop asking me about medical scribe. No, it will not help you. And if you are that 0.1% that could get in to coding because you were a scribe before, then you are an anomaly because that doesn't normally happen. And again, a scribe is not going to utilize your medical coding skill. So no to medical coding scribe. Okay, I'm going to leave that there. Now, the other thing too, medical secretary. Now, a lot of people will disagree with me on this and they'll say, well, I just need to be able to get in. Guys, if you are a really good secretary, they will not want to move you, okay? They will not want to move you. They will want you to stay there, especially if the patients love you, and especially if you're highly competent. They will really want you to stay. They will not want you to go. And if they say, well, you can do coding in the secretarial position. So maybe you're doing a little bit of the circling of the charges, right? They tell you which ones to circle and you circle those charges and you think that that's coding. That is not coding, guys. It is not coding. So that's why I tell you, avoid medical secretary because again, you may get trapped there. You may get to a point where, oh, you know, they really like you here and they don't want you to move. So they're going to make it very difficult for you to move in within the organization and then you end up having to leave, right? So don't set yourself up for that. Okay, guys, don't do it. Because also, if they're paying you to be a coder, if they're paying you to be a secretary, they're not paying you to be a coder. Even if they do give you that responsibility of selecting codes and doing the entry of the charges and stuff like that. They are not paying you to be a coder. They are paying you to be a secretary in secretarial work. And even if you say, well, that's what I did in my job, guys, again, don't put yourself there and giving all these employers all of this skill that you have basically for free. Because a secretary is not going to get paid what a coder gets paid. Okay, I'm just saying. Unless they've been there for a while, then yes, of course, obviously, they start making more money. But again, probably not going to be what a coder makes. Okay, so that's just what I'm saying. Avoid medical secretary. It's not worth it, guys. It is not worth it if this is the path that you want to take in coding, okay? Now, medical secretary is very important, yes. And I'm not diminishing that, guys. I'm not diminishing that. What I'm saying is if your skill and the time that you spend in school and the money that you spend on that school, or the obligation that you have to go to that school, that's valuable. And again, going down the secretary route is not going to help you, okay? Which leads me to my other position, medical receptionist. Now, there's a difference in the job titles, and there's a difference in what they do. And they say, well, I'll work in medical reception. No. Medical reception, again, you're answering phones. You're not doing anything with coding. You're not applying your skills, no modifiers, no procedures, no diagnosis coding, no nothing. You may see the diagnosis, but it's again, it's medical reception. It is not going to help you, all right? You want positions that are going to exercise that skill, because a lot of times what happens is people get jobs and they stop studying. They stop studying and they say, well, Blue, I've been in this job for 8 months and I'm ready to get back out there and look for a medical coding job, but I stopped studying. So again, why set yourself up that way and put yourself in a position that you're not even going to be happy with, guys, okay? Medical reception does not take the technical skill like medical coding does, all right? I'm just saying. So that's another one to avoid. Is my advice anyway. Patient access. Patient access is when, okay, they're bringing the patients in, and, different facilities have different tasks for patient access folks. They are very important to the health information cycle and not health information cycle, but the healthcare cycle. They are very important to the healthcare cycle, I will say that. But when it comes to the coding, that's not, again, what they do. And you are basically in a position that you're just kind of just sitting there, not doing anything, not exercising your skill. Patient access folks, they basically bring the patient comes in to check in, and then they take them back to the section that they need to go to. At least that's what they do at the facility that I go to. They will take them back there wherever they gotta go in the hospital. They escort them and things like that. They get them registered and things. And again, that's just not what we do, guys. We are technically trained as coders. Please do not waste your time in a position like that. And again, okay, hold your fire, because these positions are important, but not if your goal is coding, all right? Not if your goal is coding. You want to make it where your time is valued and used appropriately, okay? So that's just what I want you guys to know. When you're out there and you're looking for a job, you may already be working in a job that you don't want to be. And you say, well, I just can't wait to get out of here because, I want to get into coding. That's what I had to go through, guys. I did bartending. I worked at a halfway house. I did housekeeping. I did all of these things while looking for a job in coding. Okay? So don't be impatient if you're not getting calls right away on your medical coding job search. I've said this so many times, guys. Your resume needs to be on point. One page only. And it needs to let the employer know what you want. A professional objective. And do not argue with me, because I am a resume writer. And all the ones that I have put out there, they all have professional objectives, and they're successful. So there's a reason behind it, because a lot of times when these are getting sent through these scanners, these electronic scanners, to see if your resume matches up with what is, required in the job listing, it needs to know, why are you there? Because there's a lot of positions that open up all at the same time in facilities. So if you are not putting out there what position you want, I'm not going to sit here and guess for you. If I am a hiring manager, I'm not going to sit here and guess for you. That's why you need to be very clear. Okay. And that professional objective needs to be 3 to 4 sentences on why you want it. What are you doing there? What are you bringing to the table really quickly? You do need to have a cover letter. That cover letter is going to show more of your personality. That's where you're going to put your soft skills, that you're a team player and that you're organized and stuff. And so help me, if I catch a team player, organized, all this other stuff on your resume, on your skills, I would reject that resume, because again, that's not what employers are looking for when they're looking for coders. Okay, so that's just my little tidbit on that part right there, because I have to throw that in every time, because when it comes to applying for these jobs and trying to think of where I can go to get in, the resume has a lot to do with it too, and if you got in based on one of these jobs that I just said, you are a part of a very small minority of people who gets in that way. And not everybody gets in that way, And I don't think that employers should be, getting like people who are secretary, somebody who's a certified medical coder who works as a secretary. I don't think they should be getting that free labor, okay? Because that's essentially what they're doing. And a lot of times the people that I've spoken to that do secretary and they're trying to get into coding, they feel stuck because they're like, well, Blue, I took this job just to kind of get my foot in the door, but now they want to keep me. Exactly. Because they're going to keep you based on, okay, this person is competent in doing secretarial work. We're not going to let them go, because then we have to train somebody else. It is about them, guys. It is. So you have to be very mindful of how you're spending your energy and where you are applying. Okay, so avoid those positions, guys, because it's not going to get you that extra experience. It's not like the jobs that I recommend that are alternative to coding, the prior authorizations, the charge entry, the HCC coding, even if you wanted to do that, the risk adjustment coding. Those are some things that you can get into. There's one for insurance. It's what is a medical chart reviewer? Medical claims reviewer. Medical claims reviewer is a good foot in the door type position, because medical claims reviewer is one of those ones where you'll see the codes that were reported, you will see the documentation, and then you will see, oh, okay, well, the insurance says that it's missing a modifier, so we're going to deny. So you're essentially working on the dark side. So, but it's okay, because it's getting you that experience. It's getting you that exposure to those codes, right? So then that you can build on to go into coding. And you've already had that experience of, like, you're not being thrown into the deep end of the pool, but you're able to see, like, oh, okay, well, here's all the codes. This is what it looks like. And then you'll start to recognize, oh, there's something else missing here. Okay, so I'm just saying, that is one of those things. And I will tell you that the ones that I've seen, they're not asking for experience. They're not even asking the people to be certified in medical coding. Okay, all they're asking is that you have a high school diploma or a GED. That's what I've seen on those medical claim reviewer jobs. Okay, so that may be a road that you want to go ahead and go down, because they make pretty good money too. I'm just saying, but I mean, guys, there's alternative ways to get in, and that's one of them. Of course, I talked about all those other things, but you want your time to be valuable. If this is the career field that you really want, because people will talk about that this is the career field I want, I really want to do this, and it's my dream, and I want to do this because of X, Y, Z, and that's fine and all good and everything, but at the same time, I hear a lot of talking, but not a lot of action. Because you can have big dreams, you can have all of these things in your mind that you've heard, or the school has romanticized about coding, and you can think, oh yeah, that's really what I want to do, and I think I see all these people, and I just want to do that too. But if you're not backing it up with action, studying, reading, being out there and going to these association meetings and things like that, you're not going to get anywhere. You're going to be among the chorus of people that is saying, oh, I couldn't get in because nobody wants to hire me because I'm a CPCA. It has nothing to do with that. It has everything to do with the fact that you are not displaying your skills that they need to know about. Again, guys, You need to look at the job listings, and they're telling you in the job listings what they're looking for. ICD-10-CM, CPT, HCPCS. Believe it or not, guys, you've been trained in it. That's your skill. Even if you did independent study, you passed your certification exam, that is your skill. Even though you have no experience, it is your skill. That is your skill. So please don't tell me that, well, I don't have any experience, so I can't put that on my skills list. Your skill is what you know. Do you know ICD-10-CM? Yes. Do you know CPT? Yes. Do you know HCPCS? Yes. Do you know medical terminology? Yes. Do you know pharma, anatomy and physiology? Do you know these things? Yes. That's what needs to be on your resume. That's what needs to be there. Not all this other, I have a smiling face and I answer the phone. I don't care. I don't care, because that's not what they're looking for. Coders are rarely on the phone. Rarely on the phone. You know, if you're in the facility, more than likely the provider will come over, or you can go over to them, or you'll be communicating by email. But it's more than likely that it's not going to be on the phone. Okay, just so you guys know. But I don't want to veer too far off. You know. But that's really all the jobs that I could think of off the top of my head that will, you know, not waste your time, but take your time and not give you anything out of it. Okay. Again, all those positions are very important, but it's not going to serve you well if you are a medical coder who wants to get in someplace. All right. So that's just what I'm going to leave you guys with. I know this is a short video, but it's just what you got to know when you're getting into this industry. That not everything and not every place that you go to is going to be worthwhile. Okay, so look at what you want to avoid. Avoid those jobs so that way you're making good use of your time. Okay, so no to medical scribe, and please don't ask me that anymore, guys. Please don't ask me. It's a nightmare. It's like when they were asking me before about carpal tunnel. You know, some fool, I will say some fool because that's foolish. Some fool said, "Oh, all medical coders get carpal tunnel." Really? That's any profession that you run that risk. Any profession. It's not just medical coders. That was the stupidest thing I'd heard. And then I got so many people asking me that very question, and I did a whole video on it, and I still got that question. It was a nightmare for weeks. So no, guys, again, no to medical scribe, all right? No to patient access. No to, medical receptionist or medical secretary. Just say no. Just say no to those. And when you're out there and you're applying for these jobs and you do get calls back, you do get to go on these interviews and things like that, guys, you have to learn to relax, and you have to learn that, you know, they're just as nervous as you are when you're out there and you're applying for these jobs, because they have to weed out so many people. And you want to make sure that you show them that you are respectful of their time, that there's a reason that you're there, that you're excited to get into coding. And that's really what you want to do. It's those people who take that challenge and grab the bull by the horns, and they're out there rocking and rolling. Those are the people who do a lot better than the people who are just waiting for a job just to come to them. Job's not going to go to you guys. You have to be out there actively seeking it. They do hire brand new people. Do not be discouraged, okay? I will end this video on this. Do not be discouraged, okay? This is part of the shaping process. If it was easy, everybody would do it, okay? Everybody would do it. But it's the people that are stubborn. It is the people that are very goal-driven and they want to do this. Those are the people who end up being successful, because that's what it takes. And that's the hard thing about a lot of people now, is it's that everything is so instant gratification. And this is not one of those, guys. This is not a career field for that, you know. And maybe that's not what they told you at the school. And maybe you feel like, oh my gosh, what did I get myself into? But I will say this also, sometimes medical coding finds you. I'm just saying. And maybe this is the career that you are meant to be in. You just have to stop resisting, you know, and go with it. Get comfortable with it. Is it a little uncomfortable right now? Sure, because you're brand new and you're learning, but it's not going to be that way forever. Pretty soon, you'll be more confident the more practice you get. I'm just saying. So if this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.